Hello, my name is Matthew Bucher, and I am an undergraduate student attending Bloomsburg University of Pennsylvania. With my mentor, Dr. Jeffrey Leitzel, we are investigating the interaction between adverse childhood experiences, mental health, and substance use. Adverse childhood experiences are traumatic events that one experiences before the age of 18. For the purposes of our research, we looked to the first study conducted by Dr. Vincent Folletti that investigated the effects of ACEs. Previous research has well established that adverse childhood experiences provide negative effects to children that are often carried into their adult lives. Because I am a psychology student and a member of the Honors College, we decided to pull participants from these two areas. A link to the online survey was sent out to professors, and they were encouraged to offer a small amount of extra credit for student participation. After data cleaning, we ended up with 318 usable surveys. And the data that we found so far is promising. In total, we had 18 questions asking about different types of ACEs. We found significant relationships between the various types of adverse childhood experiences. For example, referring to the results section on the poster, we can see that there is a relationship between living with someone who drank too much and 14 other ACEs. Also, there is a relationship between living with someone who used illegal drugs, street drugs, or abused prescription drugs, and 17 other ACEs. These are just two interactions, but all of the other ACEs have a significant relationship with at least 8 other ones. This shows that there is an interaction between all the adverse experiences. It is worth noting that the data suggest adverse experiences that involve an adult seem to have a higher rate of association between other ACEs when compared to adverse experiences that involve someone under the age of 18. This could be because parents provide more of a buffering role for children, more so than siblings or other adolescents. Furthermore, in regard to substance use, we asked participants to indicate both the age at which they first used substances and also their past 30-day substance use. In looking at the associations between ACEs and both of these variables, some patterns stand out. For example, physical and sexual abuse seem to create earlier patterns of first-time substance use. The ACE regarding living with someone who pushed, grabbed, shoved, slapped, or physically hurt you was associated with 6 of the 8 substances we asked about. Also, the ACE regarding living with someone who attempted oral, anal, or vaginal intercourse with you is associated with 6 of the 9 substances we asked about. In terms of past 30-day use, living with someone who went to prison, both an adult and someone under the age of 18, provided the most significant results. Living with an adult or parent who went to prison is associated with 4 of the 8 substances. Living with someone under the age of 18 who went to prison is associated with 5 of the 8 substances. When looking at the data, and consistent with previous studies, almost all the ACEs are associated with one another. Moreover, many of the more serious ACEs are correlated with both an increased likelihood of early initiation of substance use, as well as increased past 30-day substance uses.